Thanks, Nancy. Can you guys hear me okay in back? We're good? Okay. I'm looking at Father John back there, so okay. I know you wouldn't steer me wrong. Thank you all very much for being here. I was standing up in the front corner watching you all come in, and I have to say I was a bit overwhelmed. When we began this process over a year ago, I had a lot of hope. I knew that we needed to make change. I knew that there had been an outpouring of information from many of you folks about some things that needed some refinement in our delivery of behavioral health services to our collective community. And so we went through a process to bring on some consultants to really kind of guide us through an in-depth look at the department. And my fingers were crossed, are we going to find the right team? And we got lucky and we found the right team, and I'm so thankful for that. So there was a lot of hope there. And then I thought, boy, now that we finished the report, we got to get it to the board. And I hope it goes well, and I hope the board buys into what we're saying and accepts what the report is illustrating. And sure enough, the board received it wholeheartedly and affirmed our ability to go forward and continue the change process. And you don't always know where you're going to go when you initiate some of these processes. There's a lot of risk, but today really shows me that we're on the right track, and that you all have hope and want to participate in the change process as well, and I'm very grateful and excited about that. I did want to talk a little bit about our commitment, frankly, to this process. I know that we've talked about these kinds of processes before, and many of you have been involved in before. From the CEO's office perspective, we're with you 100%. We're supporting the effort. We're going to be part of this effort. I know that a number of you are aware that we're certainly going to have a transition in the CEO's office with our CEO moving on. That is not impactful to this process whatsoever. I'm committed to 100% involvement as we move forward. The other thing I want to talk about is our board's commitment to this process. You know, there's a couple different ways that a board expresses support. Certainly part of it is that verbal expression, which is certainly what we got from them when we presented our report. Again, they accepted it wholeheartedly. The other expression of support, as we all know, is the dedication of resources. And we have those. Again, I'll be working on this process. Dr. Wada is fully committed to this process. We have engaged a number of individuals from throughout the department that are fully engaged and dedicated to this process. And then we also have brought on our COO, who will be speaking to you to help guide this process. And we've never done anything like that before. So I hope that's an outward expression to all of you of county, the executive team, the Board of Supervisors' commitment to continue through on this process. Where it takes us, I think we'll find out a little bit more today as we continue the discussion, but I really wanted to make sure you were all aware of our wholehearted commitment, and I really wanted to thank you all for being here today. You know, I can't imagine where we're going to end, but I know we're starting in a wonderful place, so thank you all very, very much for being here. Thanks.
Okay, great. Good morning. I apologize. I'm going to be shuffling through papers because I have notes, and that's what happens when you plan to practice at night but have 3 small children who decide to take a mud bath at 8 o'clock and run around the house and occupy my time with cleaning up. So, you know, it's really inspiring to see so many staff, county departments, partner agencies, commissioners, advisory board members, consumers, and family members in attendance for this systems change kickoff. And what unites us today is a shared belief that we can and need to do better in fulfilling our mission as a behavioral health system to promote the prevention of and recovery from addiction and mental illness. We share a common passion for helping people, and that's the heart of the work that we do. And it's interlaced with so many other societal issues: homelessness, law enforcement, health services, education, promoting the recovery of and prevention of addiction and mental illness. That's why we exist, and that is what our system is expected to do. And it's an important responsibility. Through fate of biology, genetics, or possibly unfortunate life circumstances, choices, or societal pressures, we know that 1 in 4 individuals are impacted by mental illness or substance abuse. Some of us in this room have been consumers ourselves, or certainly had our family members, friends, or neighbors in need of services at some point in their lives. We know what it's like, and we know that people can get better, and it's our job to help get them there. And maybe this is too idealistic or sentimental, but that's why I've always believed that what we do in healthcare and human services is special, that it's more than just a job. And sure, we need a paycheck to support ourselves and our families, and I'm not suggesting that we as individuals are better people just because we're in healthcare. There are obviously many great people in many occupations that are essential to a well-functioning society. Service employees, lawyers, business people, farm workers, police officers, probation. My father never went to college and spent his life packing fruits and vegetables in produce markets, and I can only hope to be half the man and father that he was. Yet something about working in healthcare is a uniquely special experience. It's about assisting and empowering people so they have the opportunity to live up to their full potential, so they can be there for their families and be productive members of society, so that they can lead meaningful lives. What we do has a leveraging effect that lifts us all up. When our consumers and family members come to us in need, they're often vulnerable, isolated, willing to share their innermost thoughts and feelings, hoping and entrusting us to have the clinical expertise and resources necessary to help them. We're part of that safety net. And whether it's a short-term crisis or a lifetime of challenges, we know that what we do can make a difference. I'm not referring only to the frontline practitioner in the outpatient clinics or inpatient PUF. Every single staff person in the department and the system of care has a role, whether you're a provider of care internally or with a CBO, finance, whose billing efforts bring down revenue support our efforts, IT, who develops our systems to improve documentation and communication, gives us the tools to make our jobs easier, front-end office professionals with the customer service skills they put forward, peers who bring a unique perspective based on real experience, office professionals, HR, contracts, QA, case managers, alcohol and drug counselors, forensics. I apologize if I missed anybody, but we're all a vital piece of the operation. And with this enormous responsibility is the reason why we need to ensure our system is functioning as efficiently and effectively as possible with the resources available to us. The consultants have completed their assessment of the department and our system of care. Many of you have read the report, and if you have not, I encourage you to do so, and we'll hear some of this again this morning. While they reference pockets of excellence, many passionate staff doing good individual level work, and progress particularly in the financial monitoring area, there's significant criticism and clearly identified areas for improvement. Yet without blame or defensiveness, we need to acknowledge past well-meaning but misguided decisions, approaches, relationships, and efforts, and embrace these report findings as our own, and take collective and individual responsibility for creating positive change. We simply can't continue to be a fragmented system with primary care, alcohol and drug, and mental health in silos, tension between ADMHS and CBOs, admin against staff, north versus south. We're all in this together. We share the same consumers. We have the same essential mission and motivation to help people. And we have this window of amazing opportunity with the consultant reports and their expertise, with support from the Board of Supervisors and CEO's office, and with the Affordable Care Act around the corner. Which brings us here today, the kickoff to our system change initiative. Some of the work related to specific recommendations is already underway, but we're now moving to our more formal implementation phase and system change process. Ted Myers, who I'll introduce soon, is leading this effort along with support from Tri-West Zia Partners, and certainly thank them, the CEO's office, myself, and of course all of you. And I say all of you because just a couple new people at the top and hiring on consultants doesn't mean that things will change overnight. It will take a lot of time and a lot of work from all of us. And while the tone and general direction are indeed set at the executive level, it will require all of us to participate and be engaged, to operationalize the recommendations from the consultants, to identify other areas that need focus, to bring forward creative ideas and process improvements, to empower our own staff, consumers, and CBO partnerships. We will succeed most of the time, but we can't be afraid to fail occasionally as long as we correct our course and learn from those mistakes to change the culture of ADMHS. Anyone can be a leader and change agent in their positions within the system. Everyone wants to work in an organization and system that communicates effectively, is transparent, responsive, equitable, highly functional, and accountable. We need to embody these values in our day-to-day individual and organizational decisions and actions. Together, over the next year, we'll co-create a quality improvement partnership framework to address our current and future system challenges through an evidence-based, comprehensive, customer-focused, integrated system of care model. Critical to its success will be a structure of work groups planned for key focus areas that will be comprised not only of ADMHS and county staff from all levels, but representatives from consumers and family members, commissioners, advisory board members, CBOs, and other partner entities. This is where the ideas, process improvements, action plans, and real work will organically develop. So to those of you who are excited right now, bursting at the seams to get started, we need you. We need you to participate in the work groups and as change agents, and you'll learn about that today. We also need you to pace yourselves. Be patient, as our efforts need to be systematic and strategic, and things may not get done as quickly and cleanly as we hope. We need realistic expectations. And to those of you who are skeptics, who are rolling your eyes at my cheesy attempts at inspiration, hear nice-sounding words and high-level concepts, but have lived through these initiatives before with no appreciable results, we need you as well. There will be those individuals who get on the bus early, but there will be plenty of opportunities to hop on for the ride at any point. This is not a linear journey with a destination or end date, where if you miss the bus, you'll be left behind. It's more of a cycle with issue identification, project planning, implementation, analysis, refinement or adjustment, and around again. A continual spiral upward for improvement, and we welcome everyone to join us. So this morning, we'll learn more about the process and how you can all be involved, but that is a vision for the department and how we will develop a behavioral health system that fully meets the needs and hopes of its consumers and customers, both individuals and families who are seeking help, and the system partners that share responsibility to provide the care and support. That's how we'll move forward toward fulfilling our mission of promoting the prevention of and recovery from addiction and mental illness. So, thank you. Wow, I think that's the first standing ovation I've ever gotten, so thanks. I'm now going to turn it over to Ted, so thank you very much again.
Wow, that was inspiring, wasn't it? Wow. I've hit all the right notes. We need to post that on our new website there. Eric, right on. Okay. Well, thank you very much for welcoming me. I've just been in the organization for 5 whole weeks. I've met a lot of you. You've been so welcoming to me, and I've been really excited about what we're anticipating for our systems change, our system transformation. And this is more than just the department. There is no department without all of our partners, our consumers, families, our CBO partners. We are very excited to work with everyone. So I need to speak up. Thank you for the signal. I've been asked to share a little bit about what my role is as Chief Operating Officer of System Change. It sounds like a mouthful. It goes along with Alcohol, Drug, Mental Health Services Department. But there's two parts to my role. One is to be a champion of the systems change project or projects. There's a lot of tasks that have been waiting in the queue that people are excited about getting going. We know some of those that need to be put together. We need to have a better inpatient system of care. We need to have a children's system of care, transitional age youth, adults, and they all have to work together. We have to integrate and heal our rifts between the addictions, substance use communities, and our services with the mental health services. All of us have to work together because people are whole people, and we as an organization have to recognize that. There's a physical health component, there's a mental health component, and there's a substance use component, and we need to all work together with other partners as well to best serve our clientele. So those projects and our system that you're going to hear a lot more about today, and the framework for that system, that's one of my roles. Now, did you all get a little handout showed this project management structure? I don't know if it was in the folder. It was in the folder. Good. This is just a draft. A lot of people have asked, well, how's this going to happen? And what's the steering committee? And where's the CEO advisory committee? And who are those tiger teamers? But this gives you a little bit of a structure. The steering committee at the top is a blend of community leaders that are key stakeholders in the process, as well as the executive team members. The project coordination team is the team that will be composed of leads from the various projects, as well as our staff and the project management and design team. Nancy earlier mentioned that we have a design team. Design doesn't mean a little cobble in administration that dictates to everyone else what's going to happen. Rather, the design team is about the process and facilitating a good, solid process. Just like we've tried to do in the run-up to this event with saying, well, we're going to have this great kickoff event. We need to have some participation and get input, see if it's a valid process. So we did the focus groups and the Survey Monkey, and we stumbled right away. So right off, I'd like to confess that we're not perfect. We are not going to be perfect. This is not going to be a perfect process. What's important, though, is our intention. Our intention is to be inclusive, to be transparent, to admit when we make mistakes, and we have made mistakes, and we will continue to make mistakes. I'm sorry. That's kind of the way we are as humans. But the fact is that it's very important that we have everybody together, working together in a way that's collaborative and mutually respectful. We, as people, often can devolve into sort of a blame game. There can be a lot of finger pointing on who's at fault for where we're at. That sometimes is a cover, as we know in the addictions recovery, for our own contribution to what's happening and the situation we find ourselves in. What I think we need to do, and what you'll hear more about from Dr. Minkoff later, is we need to focus outside of ourselves. Why are we in this business in the first place? What is our mission? Our mission is to meet the needs and hopes of our clients, of the people that we serve, the people we meet out in the field, in their homes, at the schools, in the hospitals, inpatient, and at our door. That's why we're here. Even administrative support staff, our job is to support frontline service professionals to give you the resources that you need, whether you're a CBO or you're an ADMHS employee, in order to do the job. Our mission is not to make money. Our mission is not to save money. Our mission is to give you the most effective and efficient set of resources so that we can do the job of serving our clientele. That's it. That's what brought us here. That's what gives us passion to what we are doing. And we need to keep that in mind in everything we do. But that is not to forget that we suffer trauma as well. There's a secondary PTSD that we suffer in our organization, just as helping professionals. We also have to acknowledge that there's been some trauma to our organization and our relationships, the way we've behaved with each other, the way administration has sometimes made decisions. And as Dr. Wada said, those weren't all with bad intent. People thought that that would be a good thing to cut this or cut that or make this change or make that change. But we know we can have iatrogenic effects sometimes, can't we? Healing is not a simple process. There is pain involved, and we have definitely made mistakes, and we want to acknowledge that. When we set up our action teams and we get going on some of these key projects, it's going to be important for us to, first of all, vent and acknowledge each other and make that heart connection to the pain and suffering that we have felt ourselves. That's going to be part of the key part of our process, and that's part of our healing before we can move on and address the goals and achieve the vision that we want of serving our clients in a much healthier, effective manner. Does that make sense? So we're all in this together. Oh, the doctor says yes. Thank you. Yes, amen. That's right, too. Okay, there's another part of my job that I wanted to mention, and that is the COO kind of role. So some of the projects, the action teams, that's kind of a structure that sounds good, it feels good, it will feel good. These are short-term action projects. They will have achievable outcomes. We will see progress. That's what we're going to do. We're not going to just talk and ventilate. We are going to get things done. But there's another part of what I do, and that's just the day-to-day software of how the organization runs. We need and we want to have a healthy, well-functioning organization. The habitual ways we act with each other are very important every day, and that happens in the office and between us, in our meetings, at the water cooler, over the telephone, and especially over email. So we want to be healthy in our functioning. How do we do decisions? How do we make decisions? How do we communicate with each other? There's a lot of fragmentation in our communication and decision-making system. And there's a lot of buck passing here, disputes over here, and we have a hard time getting resolution and meeting the needs of our clients and the staff who serve them. So that's part of what I'm going to be doing and have been doing, is on a daily basis looking at the healthy functioning, encouraging healthy functioning, so that we don't keep tripping ourselves up with these kind of broken systems. Does that sound good? Okay, Art. Art approves. In Lompoc as well as Santa Maria, as well as Santa Barbara, South County, North County, Mid-County, unite! Oh, yeah. We're number one. Okay, so final thing I wanted to say is this role, my role, is a blessing and an opportunity. I am not a savior. I was not hired to be the savior. I am just a champion, an encourager, a cheerleader. My wife was a cheerleader in high school. I never wanted to be a cheerleader, but by God, it actually feels good, because that pom-poms. Here we go. So it's fun because there are so many wonderful people in this room. There are so many dedicated, qualified, competent, and caring individuals in our system. Sometimes we have wondered to ourselves, how in the world did this happen? How did our organization descend to this kind of painful spot when so many caring people, so many skilled people are here? But the fact is that we all need help sometimes, don't we? That's the premise of our organization. That's the premise of our helping service, is that everybody sometimes needs a little help. It's not because of bad intentions. And we also believe that if we give the right kind of help, that things will get better. And collectively, that's what we're here for, to help things get better, to be catalysts for change, to encourage you to be your own change agents, to stand by yourselves and work with each other to make things happen, to give you the change agentry skills, as Dr. Minkoff says. That's what we're here for. That's what I'm here for. I'm really glad to be part of the process. Thank you again for your welcome, and have a great day today. Now I'd like to introduce Ken Minkoff, change agent extraordinaire.
Testing.